Yes. Good afternoon from Arab Emirates. It's still your cow. UD. Welcome back to my channel. Sorry, I was backgroundly. I thought I was on her own live. I swear down. So, guys, we'll be talking about healthcare in Nigeria. Is this thing is not just in Nigeria? It's not just Nigeria. It's Africa as a whole. I think whites have already survived in that aspect. Blacks as a whole, but we are going to be talking about Nigerians today. You know why? Because this is the country I come from, and I know what's going on there. And I will be talking in experience, the experience I have based on this healthcare. It is really a problem. With every crisis we are going through in Nigeria today, we are supposed to be tackling this first and foremost. This is the most important. Okay, guys. So today, the ladies of Hot Topic is here again in our meeting today. We want to talk about this healthcare in Nigeria, how it has affected so many people, because a lot of us has the experience of what I'm saying. Actually, I am talking from experience. I swear down, and I'm going to be hitting those points right now today. It's still your girl UD, Oshtonia's family, UC&UD. Guys, you've known the channel, you are inside already. This is the channel where we think, we talk, and we do everything that touches love, everything that touches the heart, story that touches, everything that is about relationship is what we do on this channel. So, guys, a lot of ladies is going to be joining me from different types of world. Some from America, US, UK, what did they call it? Germany, Europe, precisely. And I am going to invite them in now so that they will join us and talk about this particular topic about Nigerians. Okay? How we are going to better our country, because it's always what we'll be saying, and it will be working out for us. If we keep saying it, it will be working out. Okay? I've pasted it. Are you not seeing it? Guys, what's the problem? Start coming in. I've already pasted the link. So, okay. All right. I think I have one person here. Darling, don't finish me. Don't finish me. I was already here since, and I was at the background speaking, thinking that I'm online.
So who were you speaking to? You were speaking to who? To your mona, to your ancestors.
I was busy. By the time I realized that I have not even gone live, like serious. Tell me, swear down that this type of thing have not happened to you before.
It has not happened to me before. Come on. It hasn't happened to me before.
Yes. I forgot that after the first layer, I'm going to still press go live. I don't know that the first one I entered was to show me how I look, and before I come out live. So I was there. I was busy there talking, and I think I saw you backgroundly. So don't even mention. Don't even
share your opinion with us.
But I was at the background still pasting.
This first laugh, please don't take it. This laugh, no, this one is a wicked one. Don't take it. It's not
you see this spec. In fact, by next month, if I did not acquire my own, I will not rest.
Nikki, that is if she can find it.
If she can, exactly what I wanted to say. If she can actually
it is so intimidating.
Exactly what I wanted to say. If she can actually know where we got it from.
I don't understand. This is really intimidating. Guys, come off with it. A white clear spec is a white clear spec.
Madam.
Like, seriously. Hello? What did I get? The one that is better than this?
We are sorry, but you can't find it.
Sorry, this is uniquely made. For only Nikki and Constance.
Like, seriously. I don't understand. It's not the
You
same
don't
thing now.
understand. It is too hard to understand. So
It's
don't
not
try
the
to
same thing.
understand.
Madam, it's not the same thing. Your flame is bigger. Like, seriously, are you going to... Oh my goodness. So guys, welcome back to this particular episode. I think Constance
Yeah, just now. Yeah.
She's not here. Mel.
That was
She's
there
not.
before. I
She
think
was here.
I need to
She
share the
was.
screen.
Okay, she says we should start the introduction. All right. All right, like I told you guys, you already know the channel you are into, and today is Hot Topic Ladies Day. Like these women that give it to you guys, hot, hot. Different faces and different smiles with beautiful ladies. They are here today again to discuss this particular issue about healthcare in Nigeria. And with me here is Nikki.
Oh, should I introduce myself? All right. I thought you wanted to help me. Okay. Good evening, everybody. Good evening, my Facebook family. Good evening, YouTube family. This is your girl Nikki Somi Ugom. Whose YouTube is still on?
Mine? No.
Yeah.
Let's check. I think it's
Is it
yours.
mine? It should be Constance because I don't have
No,
anybody in the house.
I already turned mine off.
You have to turn off your YouTube.
I already turned mine off, not mine.
Wow.
Okay. This is Nikki Somi Ugom, and I'm one of the ladies of Hot Topic, and we are here today. Sonia, if you can mute.
Sonia, check your own.
Okay. So we are here once again to discuss on the topic, as you all know, as you all have seen, healthcare in Nigeria, which we believe that before the end of this topic for today, we might be able to get one or two things. All right. So and I hope you enjoy it. Not too much talk. So thank you so much, and thank you for being here once again. Thank you.
All right, darling. Constance.
Hello, ladies.
Oh, Mel. Mel.
I was here
Introduce
early, but you were not up, and I was thinking, what's going on?
Okay, I'm so sorry about that. I was here backgroundly doing my things. You know now, village people have arrived.
Right? You were talking to Celine.
I was busy talking when I realized that nobody is following me. Hello.
Voila.
So you introduce yourself, my darling.
Who's next?
Mel.
Constance.
Mel.
Oh, me. Oh,
Yeah.
I thought I would be last because I came in late.
Hmm. And she shifted. She shifted.
Right? Right? I came in and I took her position. Okay. We have echo, and what's going on?
Yeah, Tony, I need to work on your this thing because it's really disturbing.
Maybe Tonya is your second device. Check your second device.
Okay, because I've off this one.
That same device is on. Check something.
same
Something is going on.
The
Oh,
same.
we didn't say it's turn off.
Yeah, check it. The second, if you have a second phone, if you're using, check the volume on that phone. Maybe that one is echoing. Okay. Hello, welcome back, everyone. So yes, my name is Mel, aka Trending Gist with Octavia Coram, and I'm one of the ladies of Hot Topic. And today we have an interesting topic to discuss. Welcome back, and try to join all the ladies so you catch up on all the stories we discussed. Thank you so very much for joining us on today's segment. Thank you.
You're welcome. Constance, go ahead if she's not back here.
I'm waiting for the host.
It's still the same.
Is this still echoing? Constance, go ahead.
Okay. Hello, everyone. My name is Constance Chinema the same, and my YouTube channel is Constance Pace. I also have a Facebook page called Constance Pace. I am one of the ladies of Hot Topic, and like you guys know, we come here every Thursday to share our own popular opinion and also hear from you guys what you have to say. So today we are talking about healthcare system in Nigeria, the way forward. So thanks for joining us and stay tuned. Please share your opinion with us and have a nice time. Thank you. Host, are you there?
Yes, I am here. All right, today we'll be talking about healthcare in Nigeria, how it's affecting the nation and our country, mainly Nigeria. Okay, guys. And in this particular um, subject we are talking about today, I will be tackling it from an experience I had when way back when I was in Nigeria. That should be, should I say, 6 years or 8 years back? Okay. This particular healthcare in Nigeria has been something that we Nigerians have overlooked, especially our leaders. In most cases, we notice that our leaders, even when they have issues in health, they normally launch their children, their siblings to abroad without thinking of those bodies, which is us, and how it's affecting us. With that, they feel so ignorant of what is happening in the field of health. Okay, we don't have enough things, equipments in hospitals. Most hospitals, clinics, community clinics, they have less things to help in the organization, and nobody is talking about it. Nobody is saying anything about it, and it's a very big slap on our faces that we lost lives every day in
Sorry,
Nigeria unnecessarily.
Chineya.
Okay.
Sorry for Are you there?
Yeah.
Sorry, we forgot to introduce the fifth person. Hello, Banigos. Good evening. Don't worry, I'll get one for you. So we have a fifth co-host named
Oyoyo.
Oyoyo Ndokis Kitchen. So sorry,
Yeah.
guys, she's not here. She has a lot to take care of. She might ship in as we go on, but for now she's not here. She's Oyoyo Ndokis Kitchen and also Oyoyo's Word. So feel free to check her out anytime you are free. Thank you.
And
Tonya, sorry.
she isn't around with us here. I'm so sorry to.
Sonia, were you able to drop the number for any calling?
No, you will do that. I
You
don't
should
know.
drop and then pin it.
Okay.
Well, let me call it for you.
1 minute.
It's actually a Nigerian number, so you just need to.
Okay, 080, right?
Yeah, let me come in.
Let
Yeah.
me just do it.
Yeah, just put the code as well. +234
Okay.
817
All right.
933
933, yeah.
5215
5.
215.
All right. That's cool. So in case of anybody wants to talk, they should just contact us through
Feel free
this.
to call in on the number if you have anything to share with us or any opinion.
Yes, exactly. So please, like we were saying before I was interrupted, in
You're welcome, the Banigos. See your body comment.
my love, the Banigos, you are so welcome. You are so welcome, my darling.
Pin
Yeah, pin the number on the screen.
the number. Yeah. Okay.
Yeah, I am trying to do that too. You people want to put me in high jump now.
You are pinning Banigos. You are pinning those comments.
Oh, Mickey, you people should be careful. Oh. Why are you putting me in high jump? Like seriously.
You are pinning Mel's comments. Hello, Dory.
Jehovah. Host. I can't laugh. My chest is paining me, please. Hey, God.
Now comment you say she pin. Oh, where is our host?
Not how to give the medicine that she's having.
Mind yourself, oh, and please leave me. Everybody should be looking at it there.
So, pin the mail's comment, then pin the phone number. Your own comment. Pin your own comment.
That's the phone number that you added there. Voila.
I don't know how to do it, my darling.
How do you do the first one?
Okay, you know what? Click
Okay,
on the
wait.
comments. Look by the
done
side,
that.
you see a plus. Okay.
Okay, that's the way they do
Great.
it, right?
Very
Hey,
nice.
please, though, you will know that I am still about to blend into this. Don't just bring my legs outside. You see you Oyibo London. Why London? Biko, Rafka Maka.
Remember, if you putting patients' information on the system.
You've taught me that. I've learned this one. They said people learn every day. Thank you so much. Like we were saying, I will be talking from experience. This healthcare that we are talking about right now in Nigeria. A lot of us lost our people. A lot of us have lost one or two of our family members in the name of this not having enough equipment in the clinics around us. Okay, for me, for an instance, when I had my last child, the little baby was obviously that day the doctor was supposed to attend to us and see the children, but out of carelessness, the doctor just left. The child couldn't even stay up to a day. The child was born around 9 o'clock, and this child died at same time around 9, 10, 11. I don't even know when the child I have in my arms died, because the doctor have not seen this child since I born this child, since morning till that hour. This child is having what did they call it? Is it yellow fever or something? This jaundice.
Yeah,
This child is having jaundice. Nobody attended to this child. Nobody checked on this child. The midwife that delivered the child left also. I was left with no other person than a practicing doctor, okay, and some cleaners that call themselves hospital helpers. So they were the ones there, and they were telling me to calm down. The doctor is on the way going home. The traffic is so much; he's not gonna pick calls. And the doctor asked them not to call in at that hour. It's too late. And with all these excuses, nothing even to help the child in the hospital. I have to start thinking of moving from that hospital to another hospital. At that hour, searching for a hospital that can link to me immediately and help me out at that time immediately. At the end of the day, this child died in my arms. And any nearby hospital doesn't even have what it takes to save this child. The incubator, it wasn't there. They don't have things like that. Where you can get things like that is in Root. And the Root Hospital is a government hospital, and it has so many processes before they can attend to you. It's not something you just jump in and they will start attending to you. If care is not taken, they will ask you for so many questions, like getting a police report, getting to the hospital you're coming from, a lot of questions while the child is dying. So I think this health care of it, I don't know what you people think, but I am bringing it out today because it really hurts me. It hurts those people that have already been in my shoe. So we're going to talk about it today and know how it's going to improve. Because they said in Igbo adage is that "Onumbalu bụ ọnụ mmụọ." Is what we put on today that we help the generation. If we keep mute, it means that we admit it and we accept it, and it's good to us. So we will keep talking till our leaders notice and they know what to do and how to follow this up, how it's going to help. And ours, all of us has a contribution to this, how it's going to help, because our own understanding and our own thinking helps in the whole thing also in this generation. So I'm starting from you, Nikki, my love. Tell us what you understand on this healthcare in Nigeria, the system now.
Nikki, your love. Your love.
You dey give me ginger. Hey, you dey give me ginger. Okay, then go dey jealous me, yo. Hey. Okay. The thing is that I can't even say from personal experience, but I can say from people's experience, my sisters and all that. Yes, I was born in Nigeria. Where they born me, I know sha. Whether they say na for is it Ngozi maternity? Okay, it's like so, and I heard that hospital is still in existence till now. I heard it's still in existence, and you know what I'm wondering? The person that owns that hospital, I don't know if she's still alive or not, but what will be going on there? Then, secondly, the thing is that we have educated people in Nigeria. When I mean educated, I mean we have educated people in Nigeria. When it comes to medical practitioners, nurses, doctors, all of them, I go talk and hear. Nobody get brain past people in Nigeria. Nobody get brain past people in Nigeria. But the issue we have in Nigeria is that we lack equipment. We lack equipment. They suffer these people too much. Like over here, everything doesn't, they have a lot of things that reduce stress for those people when they are working, when they are dealing on patient, things like that. It's not like maybe you want to lift up a patient, it will give you have something that you can use to do that, and you want to do this one. There are a lot of things you can use for it, which makes life and work easy for them. But in my country, with the suffer way they the country, and I can't they give them suffer again on top the work when they do. You understand? So everybody now is looking for fast lane. Fast lane now includes that medical part. And also, just because all those private hospitals they usually have, and they tell you that this private hospital is expensive. If you can't afford it, you can't go to that place. And those are the places, according to them, they give more quality treatment. I don't know if that is true. And then the government one that is affordable for the people, when you go there, is, I don't know, according to what I heard, because I say it's not from personal experience. I've not experienced it before. It's very difficult for them to get in, or before they even attend to you as someone waiting for your turn, to be attended to. Is difficult. And then some situation whereby people lose their life. Maybe an accident happened, or there has been an armed robber case or something like that, somebody was shot. I don't know if that is they are doing something right, or let's say they are doing something they're supposed to do. But if you ask me, are we not supposed to save the life first before requesting for all this, bring police reports, bring this one, knowing the kind of place you are, knowing the kind of country you are, that if you even want to bring the police report is not something that you can bring online. You can just write to them online and get it immediately. This one, you have to go to the police station, combined with the traffic. If you don't even know if the people that brought this person to the hospital have even money to even enter bike or enter keke or anything to get to that police. And then when you get to the police again, is another case. Police will start asking you questions and then demanding for money again. Now, you don't even have money for anything, and then you want to spend even the little you have just to save a life. And because I've had cases like that, before they finish all this process of going to get this one, get that one, before they are back, the person has gone. So I remember my sister, I don't know if that was the case though, but she was pregnant then. And when you're pregnant and you have, like over here, if you're pregnant, and I'm not talking about UK, like in Europe, I gave birth to my kids in Germany, not here in UK, but in Germany, if you're pregnant and you're sick, if you like, make the sickness, they finish you up. As long as you're pregnant, they are mindful of the kind of medication they give to you. Say they get headache, they never just carry paracetamol give you, make go they drink. Say they get this one, they will just carry this one give you. What they can give to an ordinary person that is sick, they can't give it to you because of that pregnancy. And before they do anything to you, they'll ask you if you're pregnant. So they will be mindful of what the kind of treatment they give to you. So during the time my sister was pregnant with her first child, not first child, her first daughter, yeah. I think she was having, every hot body for Nigeria na malaria, every headache na malaria. You understand? So then she was having that, and then I think she went to the hospital and they said that she had malaria. And then a woman that is pregnant at early stage, you started giving her paracetamol, malaria, whatever, and she was taking it. I mean, she was taking it like a normal person that is not even pregnant.
Some of this drug could even lead to losing the baby.
It's not even losing the baby. At the end of the day, my sister gave birth to this child. The child had a hole in her heart. I'm not trying to say it was those things that caused it, but if you ask me, I will say it's contributed to it. The time they were giving her those medications, the baby was still very tender. This is not to say Peking don't reach like 8 months, 9 months. No, the baby was still very, very tender. And you were giving a pregnant woman paracetamol, malaria tablets. She was, if when a normal person is sick, how she was taking this medicine was the way was the way how it was the way a normal person can take it, morning, afternoon, and night, morning, afternoon, and night. And this was a prescription from a doctor. So, sometimes they even want to do this because they want to sell, because they will pay. They want to do this because they just want to get that money from you. It's not about your life again. It's about what they will get. So it's really like, I don't know if we should blame this to individuals or if we should blame it to the country or blame it to whomever in Nigeria. But it's just totally unfair because everything they are doing is out of let me have it, full job, but make my pocket full before I can think about anybody's life. So that's what I have for now. Until we continue, then I'll know what else to
Thank you
say.
so much.
Thank you.
Thank you so much, Nikki, my sweetheart. Okay, it be like say die global, don't go. Uh-huh.
I know they die.
Um, my love, Mel. What do you have to say about this? Because
Nobody
this is
won't die.
a very big one. And I don't know whose fault it's gonna be. We are not blaming anyone now. We are not putting in this fault on anybody now. But I think it's something we've been
Constance, please take
ignoring.
over.
I think it's something we've been ignoring for so long now. And with the ignorance of it all, I think we accept it. A lot of people have been saying, so many medias have been carrying this out. It's not as if our contribution is going to make any difference, but we will be talking. We will keep talking because a closed mouth is a closed destiny, like they said. So please, my darling Constance, come up with something that the congregation will still hear and know what we are saying about this.
Hello, everyone. This topic somehow to me, I feel is something I love that we are talking about it. The thing is, recently I heard our vice president had a surgery in Nigeria, and from what I heard, it was successful, which is a good thing. You understand? Sorry, which is a good thing. You understand? And also, I also heard a singer called Idris wants to also have a surgery in Nigeria, and people were advising him not to do so. What if they take lights while the surgery was going on and all that? The thing is, sorry, somebody's mic is on. So the thing is, I pray and I hope that Nigeria becomes a better place and a home for all, because if we want to give birth and we are sick and we are looking for, as in looking for a visa to go to another country, something we know we can do. One thing I know about Nigerians is that Nigerians are very talented when it comes to education, whatever, as in whatever it is you want a Nigerian to represent you, they come out very well. The thing is, from personal experience, I was watching one live video, and on the live video, it was a lady. She has a page on Facebook. So on the live video, she was talking about people. She was having an argument with the husband on going back to Nigeria because they are based abroad. She was like, she's not going, that she cannot go back to Nigeria, or that what if she's sick in the midnight? Who will take her to the hospital? You understand? Can she call an ambulance? But this is something she can easily get here where she is. You understand? And that stuck too into my head, because at the end of the day, she was not wrong. The thing is, that was 2 weeks ago. A friend called me on the phone around after 11 in the night. The wife is pregnant and she was having a stomach ache. So he was asking me what, as per maybe because I already have an experience as a mother. So the wife was just pregnant. So he was asking me what she needs to do for the stomach ache to stop. That it's late in night. It's late that they can't go out to buy drugs and he can't take her to the hospital. So I had to just say she should take hot water. No, not warm water. Because I told her if he was here, he would have gone to the pharmacy or even the hospital that night and she could have been as in had the solution. So he did not give her warm water to take. But at the end of the day, tomorrow morning they went to the hospital. She lost the baby. So when I called them in the morning to check up on her, he said that they were coming back from that she already lost the baby. But the thing is, if it's in as in if it was here, no one thing. I mean Senegal. Senegal is a very small country. Like I can't even compare it to Nigeria. Like when it comes to Nigeria, they are extremely very small. Like I can't even compare it. As in Senegal and Nigeria has no comparison when it comes to resources and being population and all that. But as small as they are, I would say they are organized. They have this they have working system. Well, I even forgot. So before I gave birth to my last baby, I was pregnant with my twins baby. Understand? So after I gave birth to one of the twins, I had complications, and they had to rush me down to another hospital with an ambulance. You understand? So you could imagine how fast they were to get me to the hospital, and and this unfortunately I lost the baby, but I was alive. And what happened to me was something I felt if 100 women were to be involved, maybe only 10 could survive. You understand? So, but I survived because the system was working. You understand? So, me, I feel Nigeria has what it takes to make our healthcare system work in Nigeria. It's not about when our what is it called sef, our government officials when they are sick they travel abroad. Like to me I feel it's neglecting the citizens. So if they can do better and work on our healthcare system, like provide the necessary equipment, as in we won't as in we'll not have this problem we're having today. Like have value for human lives, like provide necessary equipment when it comes to hospital, then check as in making sure they check on them all the time. Keeping the hospital environment very clean is also very important. Sometimes you could just walk into an hospital, the bed where the patients are lying, the floor, everything looks so untidy, as in it's not hygienic for a patient who is sick. Because when you talk about a patient being sick, you're supposed to protect that patient from contacting anything, any form of germs. But when the patient is in a very dirty environment, that is another additional sickness to the said patient. So I just feel that our country should do better when it comes to healthcare system. I think this is where I'll stop for now. It's really sad, Sha, but God will see us through.
All right, darling. Um, Mel, do you have anything?
Thank you. You all have spoken well. Discussing healthcare, it is massive because there are lots of points that we need to make, but we'll try and make as much as we can. Starting with the healthcare system in Nigeria. I feel like the people responsible for our healthcare are just sleeping. They are asleep completely. Like it's not as if you can say somebody is being sluggish, somebody is slow. No, they are totally sleeping. And I think it's absolutely wicked. Okay, because when something has to do with health, if you're someone that you went to school and you studied anything concerning health, then you know how much you have to be careful with everything you are doing. You need to be extremely careful. As a microbiologist, I'm not going to go into go into the lab to run it, and I just come out with anything. For example, you come, you have issues, you want to check yourself, and I just come out run and I run a test within a hurry, not checking my this is not taking care of my lab and nothing, coming out with, oh, you're HIV positive when you're not. You have to be careful with everything you're doing, and I feel like both the doctors, the nurses, and the pharmacists, and everybody involved, a lot of them are sleeping on the job. They know the right thing to do, but they're not doing it. For example, the case trending now in Nigeria, the little baby that was murdered. What kind of negligence was that? Who was that nurse that was responsible for administering a drug without reading the label? How do you administer something that kills someone's child? First, that's one, and you've done that. The next thing the hospital could do was to pull out 50,000 naira and say, take 50,000 and go bury your child. It was a mistake. If you've been to nursing school, you know how they have to be extremely careful. I'm saying this because I have nurses and doctors and all of that as family members. So you just don't come up as a nurse and you just start injecting people with anything that you see. And when you have to deal with kids,
Oh, kids.
the pediatricians are extremely careful when dealing with a child. Like Nikki stated, when you're pregnant, they don't give you anything. And when you have a little child, they don't even allow you to give them drugs.
That's all. They don't. They don't.
Up till now, if my child is, I call her pediatrician. She's like, okay, did
Just
you
water.
give her a shower, give her a warm shower, go
give
wet
her
a towel? They tell you go wet a towel and dab the baby's body. Don't overdress the baby. Do this. And sometimes they even tell you to take the baby to the sea to swim in the salt water and not do all this thing. They don't tell you go to the pharmacy. And moreover, even if you go to the pharmacy, they're not going to sell you anything. If you don't bring doctor's prescription, they're not selling you nothing.
They won't.
Whether the man knows you, whether he's your friend, whether he's your family, he's not selling. Because anything he can be arrested. So that's why I said people responsible for our medical system are sleeping. Because why are all these people just passing through the loophole just like that? It seems like you can do anything and get away with it. There's no consequences. You're not afraid of the consequences that comes with it. You're not afraid of your license being revoked. If you've been to school all these years, do you want to lose your license because of a stupid act? But nobody is afraid of all those things. And you go to hospitals and they're telling you, we don't have this thing available, something that will save somebody's life, and you're telling me you don't have it available. Did you people apply? And when you apply, what did they say to you before? And then you even go to some hospitals and they have the equipment and they tell you it's locked somewhere and the person with the key is not around. Are you joking right now? Like, we're talking about people's life. Are you serious right now? What you're saying now, like somebody just locked a place where you need something important and left with the keys. How is it that one person is holding a key to a place? So there are so many points we can make, and it all boils down to people responsible for this are not serious. And like the Banikos also made a point in the comment section saying people have to be self-aware. I think that's another thing. People are not being told enough about medical stuff and things that they need to know, just the little things that they need to know about health and all of that. So people just end up doing whatever they like and you hear things like my doctor say, whatever the doctor tells you, it's like God has spoken, God came down, and anything else you say, no, my doctor said this. So even when the doctor is not sure of what he's saying, you just go along and then you regret later on. So I think we also need to preach to people to at least know the basics. If you're a woman, you know that sometime in life you're going to settle down, you're going to have kids, then please read up. There are so many journals out there that you don't have to go to medical school to know the little basic things about your health and what you need to be aware of. Just those little things that you need to know. So when you're doing wrong thing in the hospital, you will be able to say, okay, not like this. Okay. I remember entering a place and they're supposed to draw blood to run a test. I noticed the guy was shaking. He was fidgeting. And I paused and I asked him, I said, you're a student, right? And he said, yes. And I said to him, calm down and take it slow and just do it. As a person that knows, if it's someone else, they might think that, maybe this person is not competent, but the little things that you know, so when you sight, he could make a mistake because now he's fidgeting just to draw a blood. He's fidgeting, and that can result to something else. He put it in the wrong place, and then you start bleeding and so on and so. So know the basic, just the little things that will just save your life. You need to know, because sometimes, like I was just wondering, like the lady that I was talking about that is trending, she was saying that the doctor had left, said they should not give injection to the baby. Now this other person came in and wanted to give. She did not stop that person from the beginning. If the doctor had said, do not give, that means the doctor must have checked the baby, knows that what the baby needs at that time was not injection. But then I don't understand why that the same injection was left in the room according to the story. But then if the mother was aware of little things, she wouldn't have allowed that lady to inject her baby. And she won't have lost the baby. It doesn't matter. Let her scream. Let her say, I will not come. I'm not coming back to check you. They always yell. They're always upset. Let them be upset. But this is your baby, or this is your life we're talking about, or your loved one. Stand by your rights and know what you need to know. But talking about our medical system, I feel like the medical system is not necessarily, but the people that are supposed to take care of them and watch and make sure that they're in line are not doing anything. So hence, a whole lot of things are just going the other way. Nikki mentioned that the vice president did operation in Nigeria and he came out successful. Well, okay, that's good. Let's guess maybe he went to one of the best hospitals because he has money, right? What about those people that don't even have the money to go to those very big, well-equipped hospitals, and they have to go to the ones in the village that even if you go, you don't have enough maternity beds for even the pregnant women, women put into bed, or you have beds and you have the frame, like the bed frame, but you don't have foams on
Some
it.
of
And
the
like,
wards are so unkept. Seriously.
exactly, like Constance said, place is not being cleaned. The instruments, some of the instruments that are being used on these people are not even properly sterilized. And because people don't know and nobody watches, there's nobody supervising all the villages. Of course, president, he will do in Abuja now. Abuja has lots good hospitals. Abuja does.
There's one thing
But does all our villages have same hospital that we can compare to what they have in FCT? I would say no.
There's one thing
So
my niece told
yeah,
me. My niece, sometimes it's good for you to, if you Mel, go on, please. A call is coming on my phone.
If Nigeria, well, let me shift something in now. If Nigeria was even thinking about this thing you just said there about revoking of a license, as I am a nurse, I know very well that revoking of license is just something that rampant in here in abroad, I will say. We are so much afraid of that. But so many atrocities were being committed by our doctors back home. They don't think of revoking of any license. I don't think it's happening anywhere. Because, for instance, you're saying a lot of atrocities is being committed by the clinics. I've seen a lady that gave birth to a child. They took this child from this lady and give it to the person that, did you know what the doctor said on a response when he was asked? He said, you have been having so many children. This woman has been crying for a child, just a child. And you took someone's child to another person, telling this lady that her child died. Something has happened to me in so many occasions. My doctor, I usually have a boy. All my kids were boys. So when I was like complaining of having this child and is a girl and I lost her, the man was able to tell me that you've been having children. What if they sold that child and even told me the child is dead? You never can tell what they can do. They can do more than that. They're not even thinking of the patient, because you are now out of the question. The certificates they are protecting here, their license, they are not even thinking of, as in, even the hospital can be shut down if we know what we are doing. That hospital is to be followed up, is supposed to be followed up, and is supposed to be closed down for the atrocities. But it's still very much open, working very well. The least we have heard about it is rumors. It's still going on. So what makes you think that such atrocities is not being committed always there? What makes you think that? As I'm talking to you, the child that died in my arms, I don't even know where they buried that child. I don't know where the child is. I only heard that the 9 months I carried for 9 months is no longer breathing. And I can't see the child, like, seriously, till now.
It's very sad.
Okay,
It's very,
okay,
very
okay. I was.
Do you think it's a story? It's not a story. It's just to tell you that the health background in our so-called country is something I don't understand.
Hello.
So,
I'm fine.
let me say
Yeah,
what
I'm
I'm
fine.
okay. My
You know,
my
some of
my
the
niece
topics makes me very emotional.
my niece told me something. She have a baby girl now. So she was telling me when she was pregnant, She told me that the first hospital. That's why sometimes, no, even over here, sometimes when you go to one hospital and they diagnose you of something, try another place. To know if the
Yeah,
results will come out the same
exactly.
or going to be different. So she told me that when there's this hospital that she was going to, and then they prescribed some. She was pregnant. She was going for all this antenatal stuff and all that. So they gave her some medication, which she asked them. She said that when they prescribe all those things for her, she asked them the question, "What is it for? If I take this medication now, what is it going to be doing for to me or my baby or anybody?" So they said that the nurses couldn't even explain what the medicine is for. So, and then what she did was she took the medicine and then she went to another hospital and then showed the doctor the thing. So the doctor now told her that as a pregnant person that she should not even try to take that medicine. And she said that the thing was even expensive. But the issue here is that before she went to that second hospital, that she has taken that thing already, one, because it's like maybe it's a pack. When she finished the pack, then she'll go and get another one, and she said it's expensive. So their own be say, come and buy. Let just give us the money and buy whatever is doing to you. It's not our problem. So she was doing it before she now went to that hospital and they told her that she should not take that thing again. You understand? So you can imagine if she didn't go to the second one, what would have happened? Probably the next minute they will start telling her the baby is this one, she's having complication from there, blah blah blah. Before you know what is happening, bam, the baby is gone. And then they will target one thing. Either they target stress or target this one, that one, and all that. So sometimes it's very, very good and important that when they tell you, okay, this is what is happening to you, this is how you're going to treat it and all that, try to go to. I know sometimes, one thing with our country is that money involved, because every hospital you go to, before they attend to you, you have to drop something. So all the money involved,
Nikki,
sometimes,
please, I want to ask, is that same thing done in Europe?
no. I
I'm
went
asking
I
as
went to
someone who is still in
wait,
Africa because
let me show you
just
something.
last week,
Pay your
like
insurance.
last
Wait.
week I was sick.
Oh,
So I know I didn't tell you guys. I think it's my
around.
mind.
No
I
vex.
was sick, so I was trying to manage myself. So I went to my children's school on Friday to get my son's results. From there, I went to market, and when I got to the market, I was having this eye turning, so I had to sit down and got myself before I started coming back home. Then the next day, I was kind of I was sick, but I was still managing myself to do some shows. So when I went to grant my children's pap, I went to bring it back from the place. So I was about carrying it upstairs. The next thing I saw myself, as in the next place I woke up was in the hospital. You understand? How I felt, what happened, I didn't know. You understand? I saw myself, I fainted. Is it fainting or slumping? I don't know the one that happened to me. I'm laughing now, but it's funny, seriously. I didn't know what happened and I found myself in the hospital. So, but I feel much better now. I had to run some series of tests. But from what I was told, you understand, immediately I fell, the caretaker took me, as in they even put my dress. I didn't know, they rushed me to the hospital. But immediately they got to the hospital, they took me to the emergency ward. They started treatment immediately. Because what happened to me is something they say sometimes when you slump before you get to the hospital, you have passed away and all kind of thing. So they
Sonia,
took it very, like, they had to give me first aid, check my tension, my sugar. Like, the treatment was very fast. You understand? And aside, maybe okay, I was having a car, they took me to the hospital with my car. Even if they had called an ambulance, before 10 minutes, the ambulance is here. You understand? This is a country having a working system, like having value for human life. You understand? Like I told you guys earlier, the lady said that she can't go back to Nigeria. What if she has any problem in the midnight? Well, how can she get to the hospital? This was one of the reasons why she said she's
Sonia,
not
can
going back
you
to her.
mute? Can you mute, please?
Okay.
You understand? This is one of the reasons she said she's not going back to her country. So I don't know if we can improve more. Like when it comes to that healthcare system, ambulance, like, it's sad. Seriously, it's very, very
Have
sad.
you seen where ambulances when they call ambulance?
But like serious,
In
Nikki,
Germany.
on which road now? You're talking about ambulance.
You understand?
You have to talk
Nikki,
about the
sorry,
road first. Sorry, Nikki. Sorry to cut you short.
Any little
Who
accident,
actually,
like
who
before
actually,
5 minutes, they
Constant,
are
sorry,
here and
Constant,
they are
sorry,
going to
my
give you
darling.
first aid treatment before you get to the hospital. Tell me, how
Who
would you survive?
actually invented, I'm just confused here. Who actually invented in Nigeria where you must bring some certain things like police reports and all that before they will attend to you. And somebody that is dying, as in
Seriously,
nobody
It
talks to you.
depends. Tonya, it depends. Mostly for like gunshot wounds,
No,
you
no,
have
no,
to be
no. That
sent.
one, no, that one you are supposed to call in police. That one is aside. But for somebody that is, I am dying, I came to the hospital, and you need me to deposit money
No,
first before you
but,
start attending to me.
but do you know,
even with
even if it's
gunshot,
gunshot,
they
even
start
if it's gunshot, yeah,
hospital
see,
treatment
come
is
on now,
very
this is a gunshot, yes.
But let me,
This person is unconscious, yeah.
but
The
let me
person
even
is
tell you.
injured, wait,
But
I'm
let me
coming,
even
I'm
Now
tell
coming,
you
you.
I'm
have
coming,
to,
I'm coming.
because it could
Wait,
be, it could be a criminal. It could be so many
when
things.
you're
You have to
treating this
present
person, when you're treating
a
this
police
person,
report.
no, when you're treating this person is not going anywhere. This person is not running away. At the process of this treatment, you can call in the police. They can come
Okay.
in. There is no way one
Let's,
person can overcome
is
okay,
very
okay.
important.
Constance,
That's
you
what
say
we're talking
something.
about.
save the life.
Constance,
Yes.
Constance, you say something about first aid. My darling, first aid only works here in abroad. I've heard of it, and I know that it's
So
working.
I
If
mean,
something
the
is happening
ambulance
to
itself
anybody
has
now,
first aid. Like they start giving you
yes,
treatment even before you get to the hospital.
yes. Like I studied BLS also. The first thing we do to somebody that is unconscious, that's slumped, is to attend to the person immediately with some complexion. But you can't see such thing in Nigeria. I don't think it happens anywhere. If something is happening to
You
somebody in
that
Nigeria, you must have to take that person to the hospital with hold up. Oh, with the hold up. Oh, my
Do you
friend
know?
died in the hold up. Let me be
Do you
telling
know
you.
ambulance? When you call
I said
ambulance, the
I
matter
talk
the
most
amount
of
of
this
hold up,
out of experience.
the matter
One
the
of my
amount of
friends
traffic.
died in the hold up going to hospital in Nigeria. Nothing much is happening to her. She's just slumped that evening. The husband took her inside the
so
car.
the thing is,
Don't bother calling ambulance because you're not going to see any ambulance. You are going
when
to
we
see
talk
your
about
forefathers.
change, it's not just the government. It's the citizens too are included.
Exactly.
Yeah. Here, an ambulance, whether it's a police ambulance or hospital ambulance,
You
like
go
you
throw
just
away your
clear the
time
siren. Like
bush.
you just clear the road and
You
allow
will
them to
clear.
come. When I was giving birth to my last baby, like after I had the complications, my husband said he couldn't imagine how many minutes we spent on the road before getting to the next hospital. Like it was so fast. Like he was taking one way, like the way they were clearing for him to pass, because they knew whoever was in that ambulance was at risk. You understand? They were clearing road without even, as in, you don't even need a policeman or anybody to say clear the road before you know you have to clear the road. That is having value for man. So it has to even start from the individuals knowing what is right, knowing what to do. But in my country, when ambulance is coming, everybody just stay on their line. I beg, rest, I beg. That thing you are doing is disturbing my ear.
The thing is that
But that is why people that you have to say that the people that are supposed to enforce these rules are not doing it. Like first of all, when you talked about when you slumped and you were rushed to the hospital, imagine that there was no money. It was someone from a family that they don't really have much, and all the people around and the area they live, they were kind of people that are kind of
now.
So when you
Okay,
get to the hospital now, they will not ask like you to deposit money first.
On me. They always let me on me before they even told them to go and pay the
Yeah, because they have a system that works. That's why they commence treatment, knowing fully well that you're going to pay. But because our system is not
Okay, Mel.
nothing is happening.
Let me tell you. For instance, with what this lady is saying down here on the comment section, Hilda, they value human life in Europe, life in Europe. In Africa, they will first ask you for deposit. Exactly what I'm saying. Here in United Arab Emirates, they take care of you first. After, maybe your ID can be stamped.
Well, you cannot say in Africa, because Africa is massive. That's the second largest continent in the world. And Constance is in Africa, and she just explained it that she was attended to. It depends. We have countries that the
It's
system
not all
is working.
Africa. South Africa is exceptional. South Africa have been there. I've stayed in South Africa for a year, 6 months.
South
Yes,
Africa is Africa. Now, South Africa is not America. South Africa is not in Europe. South Africa is Africa.
that's what I'm saying. What you're saying is
And
absolutely
yeah,
okay.
that's the
Mel.
correction. I'm trying to correct what the person said, that in Africa you cannot stay in Africa. You have to be specific with the country that you have experience with, because we have other countries that they've tried their best, and let's not use the what's the word I'm looking for? Let's not use people that are being wicked to also tarnish the image of other people that are doing a good job. You know, there are lots of African countries that you'll be proud of to say, yeah, oh, this is Africa and this is
And
happening. So we have a lot of countries.
this
You
system
that said,
giving
talking about ambulance service is very bad. You only have ambulance. You have to have fuel money before they will come. Can you imagine that? You have to have fuel money before they will come.
Are you just hearing it?
But the point I was even trying to make, you people are talking
Let me
about
shock you.
ambulance. Before you get to the ambulance, have you talked about the road? What road
let
are
me
you
shock you.
driving on?
Now, let me
What
shock you.
road are you going to drive on?
See what
There are
Constance is
potholes.
saying.
Where are you
Eh?
going to drive on? So there are so many steps that you just see that at the end of the day, the government is not working.
Okay, Mel, let me shock you.
The
Constance
government is not
complaining
working,
of fuel.
and it is obvious that they are not working. So it's not even about the vice president doing his surgery in the country. Of course, they can take care of it because he is the vice president. And if he's doing a surgery and he's in Abuja, for instance, he's gonna do it in Abuja. Okay, where is he going? So let's talk about those people that are in like Bagwalada and all of that, and other part of which Gwagwalada still has road. Let's go down to other villages in south, east, and the rest. How many roads do we have? Look at east-west road.
Do you know why?
Is that a road, or that is a pond where you can catch fish?
But isn't that same?
So where would the ambulance pass if there's an emergency?
Isn't that same road? Somebody is saying here now, if it's politicians, they will clear road for them to pass. It's not that same road we're talking about here.
So
They clear road by force. You have to add that the road is being cleared by force.
Yeah.
Because now you have police, you have soldiers that are coming down with whips and guns to hammer you away from the road. You know, that is by force, which is also against the law, because it's human rights to come with their own.
I think Oyoyo wants to talk, lady.
Yeah, it's actually very sad.
Is she here? She's calling in.
Is right.
No, she's there. She's there.
Hello, ladies. Sorry to interrupt your lovely discussion. First of all, sweet,
You're all of us, Joe.
my baby sister, I need to check on you. I don't like the way you're looking. Okay.
I'm not feeling fine.
Please.
Me too, I'm not feeling fine. But
You're shining. I was in your live stream this morning, so don't tell me you're not feeling.
You see that? Oh, yeah, I'm not feeling fine too. But
No,
what
you
about
are
me?
feeling
I'm
fine.
not
Me
feeling
and
fine.
you met already.
I just did my graduation. Nobody checked on me.
I
That
went
is
to take my
complex.
tablets.
It's only Constance that checked on me.
Did we not check on you?
Mel.
Congratulations.
Constance did not even check on me.
Sonia, we said congratulations. Anyway, I wanted to say something before I continue. I don't want my husband to meet me here. You see, this man, he wants to miss our trip. So let me quickly say something. See, Tony, all of you are making valid points. And also, personally, ladies, Tony, honestly, I feel so sorry about your story, but God is your strength, and I love the fact that you're smiling.
No, nothing weighs me down.
Constance, you were able to get medical assistance because you're in a country that has a system. You're in a country where things work. Mel, everything you're saying is right on point. Go to my village healthcare. They will come there. You will even see Fensic. Is it Fensic or Parada, they call it? You won't find Fensic. They will give you people are laughing. It's a serious matter. There was a video of a health worker in Enugu State that made a video of where they go to work every day. No ceiling in their premises. The beds are not even, they don't have leg. They're using things to tie the bed where you're going to put patients. So it's a very bad situation. And also you said when they bring somebody, they will first ask for deposit because there is no insurance system. There is no system that works. And you know our people are so crooked. I don't want to say, but let me just say they are fraudulent. You can treat the person, and by the time they tell Madam, I need water, you nurse will go and get water. They will disappear.
They're learning from the government.
You understand? They will not pay. So anybody opening a hospital must have tied a rope on their waist, thinking of, okay, this is not a government hospital. I have to foot my bills. I have to pay my rent. I have to pay my nurses. So it's until we start having something like this registration number they give everybody, so that they can attach it to your name, to your village. In case if any crime is committed, they will know how to trace you. We don't have any of those. For those comparing, South Africa is no longer Africa. It's almost like Europe. People would look at them like European country. If a country like Senegal can get their system working, there is no reason why Nigeria cannot work. The only reason is what is not working is that the people on top are embezzling because they can afford private jets.
We have Minister of Health. I don't know
Like
what
seriously,
he or she is
when
doing.
python is busy swallowing some, and the rats also consume, how will it work? How will the system work?
You know, if you guys notice on the news, Obi was congratulating Oshibanjo for using a Nigerian hospital for surgery. That will be the first. It will be the first. A high-ranking Nigeria is going to do surgery in Nigeria. That will be the first, because
they're not ashamed of making it a news.
No,
they make
Obi
it a
was
news.
trying to make a point.
But Oyoyo, don't you think that's another political move?
It might be
It's
a
another
political move.
Okay, just like what you said. Mel, just like what you hit now. There is this governorship the man is looking for. I saw him inside the gutter in Facebook trying to remove things from the gutter. That is not the first start of this. I don't know if you people saw the picture. Okay, why is he inside the gutter now? To tell us that he can take us from the gutter.
I saw it. Even the people cleaning the gutter that look dirty, they were cleaning from on top.
What's the meaning of that?
The rep went inside the gutter to clean. Inside. Oh.
Can you imagine?
Which is Abada.
Eh?
When I saw it, I said,
I mean, to nurture us out to good Nigeria.
It's already bad, but we can do better. Nigerians overseas are celebrated everywhere. They are the best doctors in the US. They have the highest number of college graduates. They have the highest number of home ownership in a country that they came to live. You can understand that. Then, because they are driving everybody to leave, we are all living. And if you notice, the people that are living in Nigeria are the Southerners. So we are all running away and then leaving the country for the Northerners. You get what I'm saying? So the thing is that they don't want to make the place workable so that people can continue to vanish. But then again, if they have structures in the country, then somebody can walk into the hospital because they know you have insurance card. They will be able to treat you. Overseas, if you come to hospital, the first thing they will ask you, where is your insurance card? We should not overlook that part.
Yeah.
And when you don't have insurance card, they will say, okay, you don't have any insurance. How about state help? Any social service thing? And you say, no, you don't.
And if you don't have all those things, that is where your money is going to come up so well.
Like they will take you. They will treat you, but before they will treat you, they will call. Before they will treat you, they will call insurance people immediately. That they will come and help you, so that they will register your name like somebody who has no insurance to see the benefit they have in their hospital, whether any of them can cover your bill. We should all remember that. It's not that the way you go overseas, they will treat you. No, they are treating you because they have some funds set aside by the hospital management to cover such expenses. They're not treating you for free. Somebody else is paying the money, even if it's not coming from your pocket.
Yeah.
I remember when I first
came.
And
sometimes it's coming from your pocket as well, because let me say, when I was in Germany, it's even here that I would say I don't know if they're taking it from my salary or not. But I'm not paying money, and it's called insurance money, you understand? But in Germany, you pay, it's stated there that this is insurance money, which you pay every month. If you're working, they take it automatically from your salary, yeah? So when you're sick, you just go to the hospital and all that. So when I came to the UK, there is nothing like me paying insurance money, things like that. But I know that anytime as long as I'm registered, I have my NHS number. Anytime I'm sick, like when I was having when I was having this migraine, I went there, they took my blood, do a test and all that. And at the end of the day, they told me what is wrong with me. They carry medicine, they just write the prescription. When they write, they will just ask you which pharmacy do you want to go to. Anyone around you at all, you can just send the prescription to them. You go there, tell them your name, they'll give it to you, you go. You understand? There is any other body that is taking care of those things, it's okay. But just imagine if it's a place whereby you have to pay. Or they can't write and for you finish. They can't say, you have to pay like 30 or 40 pounds.
You still in the US, you still have to pay. But we are not stressing that. We think coming to the hospital, you just walk in and they will give you services. No. But once it's an emergency case, they will treat you first.
Yes, exactly. That is what I was even trying to say.
Questions, your name and all of that, getting more information about you so that they will put you on a particular
if you don't have insurance and you have an emergency, they are going to treat you and you
immediately.
Go just know you that there is another body, another organization somewhere else taking care of that.
Of the bill, yeah. I remember when my mother came here, the few times she's been here.
Here, there's what they call charity. There's what they call charity organization here. The charity takes care of so many things. Even our people that born like a fowl here. Is that charity that takes care of all those things, because 25,000 thereabout is what they used to have a child in this United Arab Emirates. You know how much is that in Nigeria? A huge amount of money. If you go for something like, if you have insurance, you will be getting your operation around 18,000 dirhams. 18,000 dirhams is there about 3 million now, with the highness of everything. Okay, if you happen to have insurance and you have a safe delivery, you just spend just 100,000 Nigerian money and you have your child.
That's when you have insurance. And for you to have insurance, you have to live in the country or be a resident for you to have insurance.
But if you don't have insurance, you don't have anybody for you. That is what they used to ask in this UAE. Do you have a mother? You'll be seeing it in TikTok. Do you have a mother? No, no, no. You have brother? No, no, no. You have sister? No, no, no. You have no, no, no. Only me. Now they will take care of it.
Yeah, those ones are applicable. And the same Nigeria we are talking about, we should also know that private sector, they have insurance scheme for their people. It's only the government sector, I don't know how well they structure this. The government sector also have insurance scheme. I could remember when my family that are in government, when they were ill, it's just that it does not cover your whole bill. But the people that are not working for private, not working for the government, they are business people. There are somebody hawking gala on the streets of Lagos. They don't have insurance. They don't have any coverage. And there is no funds whatsoever set aside in hospitals that will cover them.
You said who have insurance in Nigeria?
No, private sectors and some public government sectors. They do.
I don't know any public government sector that have insurance.
No, they do. My sister work with NYC. Okay, she has also health insurance. The husband works with National Assembly Abuja, so he has insurance. Okay, that's why I say some government sectors have insurance, but it does cover half and half, not full. You understand? And even overseas, some places you pay, they will pay 80%, you pay 20%. If there is any country that they have crazy high medical bill, is USA. Everything here is over the roof. That's why some people are even living here for Canada because of the high medical costs. But the thing is that if we can equip at least 2-3 countries per state, 2-3 hospitals, 2-3 hospitals per state, and set funds aside. Those funds they are going to set aside will cover up for those who cannot afford to pay their bills, who do not have money, who do not have insurance. Those kind of funds can take care of them. That's how hospitals survive here. They have hospitals that are for charities in the US. They have those that are for pure business. Okay, so if you know you can't afford the pure business, you go to hospitals that are for charity, whereby if your charge is $1,000, you pay $20. That $20 is expected that you can afford to pay it. You understand? For example, if you can't pay it at once, you pay it in installment. They make everything available for everybody, even your own part of the bill. You don't have to pay it at once because the system is working. But Nigeria has no health system whatsoever. No health system at all. If your mother is in the village and she's sick, they will go to healthcare in the village. I'm not even bothered about the city anymore. Healthcare in the village, the nurse has not come to work at 10 o'clock. They will have to call nurse from the face, say, well, sorry, I don't know anybody sick today. I go market. I didn't walk market.
Market or farm, said, which network are you even calling the person with when the person is in the farm?
They have phones now. So they will say, oh, sorry, I didn't go
Yeah,
market.
but the network is bad now. You cannot get them when they're
But you're not in Nigeria, but you know how the system works.
Why are not going to? My
Someone
mother refused to come and live with me overseas. Say they stay in village. So how am I going to know? The last time they had to
our
do
health
a nurse.
clinic, our health center in my village, actually, anytime we went to that place to visit one of my my mother's friend that is called midwife. Now midwife we they call her. Now in behind mid. Now waiting we they call her. So anytime we go there to visit her, she will be inside the corn farm where she's harvesting corn.
That's what I'm talking about.
Yes, he will call her. She will have to come out with us this type of goggles that.
So that's what I'm talking about. Don't you guys think they're supposed to at least send youth corps members that studied medicine or that studied nursing in those rural areas? Don't you guys think they should send? We're talking about how to improve the healthcare. We have youth corps graduating everybody wants to go to the city and serve. The government to start making it. If you're serving in the rural area, you'll be paying 21,000. If you serve in the city, they will pay you 15,000. That will shift the attention. There are so many ways to do these things. It will shift the attention. And then if you're a medical personnel, lab technician, nurse, a microbiologist, anything related to the medicine, put them in those rural health centers, but they will not do it. And
we
are
have
dying.
all it takes to make all these things work, but they're not even making any attempts.
They are not making any effort. Is it the boo-boo that is tired already? He wants to run back to, I don't know if he's running back to Castina or running back to Niger, that is interested in what is going on in my village. If you even ask boo-boo how many local governments they have in Nigeria.
But the masses too need to receive some blames because, for example, now we're all pushing for PVC, right? Did you see the video trending?
Which
go get your PVC. Have you seen the video trending where the politician is giving 500 and his security man behind is collecting the PVC from the people? Did you see the video?
What?
It's online now. When you finish this, go on Instagram and watch the video. He's giving 500 and the next hand is collecting the card.
That was the last election. I saw it.
So even the masses are also their own problem.
Exactly.
No, the point is that it's not just the top, it's everybody. I had a heated conversation a few days ago when I went to see my sister-in-law. And we're asking one of the daughters, are you telling people in Nigeria to get her PVC? She said that we should leave her alone, that it doesn't concern her. I say, excuse me, it does not concern you. Do you know it concerns me? Still, how does it concern her? I say, listen, I'm the one that is married to their family. Do you understand? I said, I have a sister-in-law in the village. Do you think if Boko should come now to invade that village, where can she run to? Because she can't even move around. She's no more, mobility is gone. You see why it concerned? The mother was shocked. I was pointing that to the daughter. I say, you don't just feel as if it's none of your business. It's our business. Take it so seriously. If anything should happen, we have people there. Tell the people in your WhatsApp chat, go get your PVC. The next thing she told me, what if they have the PVC? Will it count? I say, she said, it's only God that will save Nigeria. I say, everything is not God. God has given you the opportunity for you to do your part. It is until you do that your part. That's when you move God to action. You can't sit in the comfort of your home watching Netflix, expect the Northerners to go and vote and stand on the line. Tomorrow you say, God, there's not helping Nigeria. Faith, we have to help ourselves. You have to help yourself. So even if we like now, okay, I just thought about something, them a movie making a youth service very lucrative for those going to serve in the rural area. Is it that nobody has ever thought about that? Young people, they need money. And if they come to my community, for instance, they go give them free housing. You see where married women that will even be cooking food for them free. For that 1 year, they are going to stay with them. And
But even let's even forget about the coppers. We have graduates that are looking for jobs. Are you saying if they tell them that they're going to pay them very well, they're not going to go to those rural areas to work? When every weekend you can take the next bus or whatever and go back to the city to enjoy yourself and come back.
Exactly.
You're getting paid every month.
Mel, no graduates want to work in the village.
If you will offer a good salary, a graduate that has been in the street for, let's say, 10 years,
they will.
5 years after graduation, no job.
As long as the money is attractive.
Even if it's in the bush,
about those
that
have been in the street for 10 years. What experience are they going to work with? They've forgotten everything they learned from school. They're going there to kill people. We're talking about
that's why if this kind of opportunity is given, immediately they're coming out from school.
Thank you.
They're applying for jobs in such places and then start immediately. Because what they're looking for is
what kind of school did the person go to that the person forgot what to do in 10 years?
Man, you're saying 10 years. Some will not even know how to trace the vein again. Vein on your hand. Some can't trace it. 10 years. You see, Constance says she has forgotten. And Mel is here questioning me. I tell you. Okay, Mel, another thing I'm going to ask you. When you were doing CCACO after graduation, did you agree to go to the village to serve? Did you?
If they have offered
I'm not going to service, so I don't owe.
You don't go service. See this Chico.
I don't do all people like us, they go service.
If you just finish, carry your certificate, run away, but disappear.
I know Savo. Me, I know Savo.
Old people let they serve. Now, not be 25 years old. How old are they? I don't know. I don't remember.
You serve in the village.
Castina village.
Are you kidding me?
But me, I won't have mind. I won't mind the village. Why not? I would have gone. Not be not. I don't want to go not. But any other village, I would have gone.
Funny enough, serving inside those villages, those rural areas is fun.
Thank you.
And what if they send you to Sambisa Forest? What if they send you to Sambisa Forest?
Tonya, at the time Constance was talking about Sambisa Forest, it wasn't that bad. You get what I'm saying? This thing happened in a space of 8 years. That's how bad it has gotten. So at the time, I served in Nasarawa State. You understand? That was where I did my research.
They were pampering us like, giving us.
They gave me an apartment. I have room, I have parlor, I have kitchen, toilet, separate on my own because I came to serve.
Yeah, and all those places they will have
those
big
places,
houses.
if you are you are gold, like gold. The papa you like
in the compound, hey, copper shop, they will just be liking you. So they will have a way to remedy the situation in Nigeria, but they don't want to, they're not interested.
Neglect.
If they set people free financially, they will find out that everybody will want to be like them. But they want to keep Nigerians hungry, keep Nigerians poor. That's just the truth. So we have ways to go. Look at our doctors in the US. You remember when there was something that made a news? A woman, the child was having crisis in the belly. They had to open the belly, treat the child in the belly, and then put the child back in the womb and cover the child. And the mother carried it full time and then had the baby. It was a Nigerian doctor.
Wow.
They say they have never done that in medical practice. It was a Nigerian doctor that
I say Nigerians are when it comes
we are talented. We are gifted.
You know, when they come over here, the system of education here is so easy. So they even see like what is that they do here? This one at school that they go, because it's so the way we study in Nigeria is not the same way they study here. Here then they do us baby, just read. But Nigeria with that strong hand, they don't use. As in you don't read finish. If you come over here, everything is just like this. So imagine if they give them the kind of
Nigeria, Africa, use Africa.
Their hand. Hey God.
My son at his age reads at midnight.
You see that? You see that? Here now, who won't wake up midnight read for you? As a matter of fact, they will tell you, 8 o'clock, you don't
You
sleep.
wake them up, they cry, they go cry for you, eh? Mommy go beg them, mommy.
No,
You
the
go
issue
beg
is
them.
when they wake up by midnight after reading and then go to the class in the morning and then start feeling tired, they will call you on the phone. Oh, sorry, Treasure came to school today and she wasn't really. I think she was feeling so tired today. Is anything okay? Is everything okay with her? And what's happened? Because she was feeling tired. So that is it. That is the way they is. So imagine if Nigerians have all the equipment these people have, would they even have time to wait till they want to use abroad do?
Thank
We are
you.
talented. We are
Thank you.
talented.
What are we
What
even?
it takes.
See, we should. I hope somebody is hearing our voices. There are ways to go about this. There should be remedy. It shouldn't continue this way. If they can put security in place in Nigeria, a lot of people will want to return home. I have a lot
Yes.
of retirees in the US, but they are afraid of going because of healthcare. There is this man, he said if only Nigeria has health system, he would have gone.
It's not
But
even
he
only
can't go.
healthcare. Now security is involved.
He has pacemaker
Security
in
is not
his heart.
involved.
You understand? So imagine his heart is functioning with a machine. He has irons. Which hospital in Nigeria will have that time for him? So a lot of them, there is one man now, he's heading to 80, but he can't return back to Nigeria. Simply because of
say
health
a
system.
lady, the other one was jokingly saying to her that they should go back to Nigeria, like on live video. She was saying it that she's not going. What if anything happens to her in midnight? How
Do
will
you
she
know
get to the hospital?
one guy that came over here
That
to do
was
his
a major reason for not going back.
a guy that came over here to do his masters, yeah, and you know this tuberculosis test that they usually do. So this guy was telling me that even if you're living in Lagos, and I don't even know whether they say they have only one center, 2 centers in the whole Nigeria for that tuberculosis test. So you have to, like, if you want to go for it, maybe it's, I don't think, maybe it's in Abuja. If you have to go, but you have to leave wherever you're living. You leave very early. Prepare yourself to sleep over. In fact, you can even stay 2 days, 3 days, because sometimes you go there, you see like more than 1,000 people that are there to do the same test. You know, so you not ask yourself in this kind of situation now with the huge amounts these people
Every
pay.
state should be able to do every
That
state should be
story,
able to do the
yeah,
test.
that story, I don't buy it. You know
Yes.
why? I
Every
don't buy
state
it.
should
As of the
be able to
time
do
I
it.
was, my niece was a year old in Oka, and that my niece is now a big girl. She has kids now. She has 2 kids. When she was a year old, we went to visit her in the hospital. So to tell you how many years ago, the hospital in Oka at the time, they did a tuberculosis test as even a private hospital.
That was then, no, yo,
No,
not now.
it can't be bad. It
No,
can,
I know someone
Yeah.
that just did. I know someone that just did recently, few months ago.
So
You
they
can
should
do
be
it
able to have it
from
available
Rivers State,
across
from
Nigeria.
Port Harcourt.
He did it in Port Harcourt.
Yes,
Yeah, they should have that available. It's just a simple
it is.
test.
It just depends on where you're staying. Maybe if you're staying in the village,
the question
it might
I
not
have
be
to ask now,
available.
with the question I have to ask now, that one that the person did, was it for travel purpose or just the person just did it for just doing sake? Yeah, is it for
No,
travel
the person,
purpose?
the person was ill and coughing,
It was
and
ill, yeah.
they had to run
But
different tests.
but you know, in some
Yes.
cases now, they will tell you
Tuberculosis.
for you to travel, there is a particular center.
Okay, if
that
it's
you
for
have to
travel
do.
clinic, if
Yeah,
it's for
that's what
travel
I'm saying.
clinic, that one
There
is
is a particular
different.
center that which is something that you can as well.
Nikki, you know why? You know why? You know why they do it that way? Even the yellow fever, they don't accept your yellow fever test from anywhere. Why? Because they feel like people forge it. Even the insurance, travel insurance document, people forge it. You know, so that's why they have specific places where they tell you to go and do it and bring, which I feel they have a level of trust with those names. So
Yes.
hence you have to go to those places. Even if
Only.
your next neighbor can do it, they will not accept. They have people that they are working with, each embassy and all of that. So if you're traveling, of course, you have to go do your medicals in certain places. You just cannot go to Federal Medical Center, your state, to do it. They won't accept it.
Yeah, that's true. Because if you, for clearance purposes, the criminal background, they will refer you to Panti. Whether you did Anambra State, you have to come to Panti. Whether you did, you know, and those are is also, I remember, if you're doing your citizenship here, and if you're born from 1970 down, You can't just present any kind of certificate for them, telling them that you don't have birth certificate. They will refer you to Nigerian population census. Okay, you know the way we were entering university, if you look for your birth certificate, you can't find it. They will just go and do affidavit of swear affidavit for you, declaration of age.
Yeah, I don't swear the affidavit tire. I don't know where my birth certificate
see my
is.
own now, the one I used to enter university, I still have it. So when I was filing for my stuff here, I put it in. My husband said, "No, that's fine. Since it's very old, you understand? They will not even." By the time I finished, they sent me a letter back. So, girl, you were born after the 70s, so you must have records. You know, people before the 70s, because of civil war, they can do some way. They say, "Madam, you were born after the 70s. So anybody born from 1970 to date, you must produce birth certificate." And I started asking my mother, "Mama, where my birth?" My mother says that we have moved house now, that she doesn't know where the thing is again. Honestly, they had to send somebody to Oka, where I was born, to go and get me birth certificate. Oyibo no agree use my affidavit because they don't trust Nigeria.
Back home in the country. You can go to whatever that is a certificate you need. Once you go back to where you did it, or even a marriage certificate, wedding certificate, you can go back to the church and get it still.
I was born in St. Faith, Okuya. That's where we stay. We went back now to St. Faith, Oka. Now you go come live in America. Go get her for me, right? You know the tension that thing gave me. I now start asking myself, if you look at my declaration of age, it was before I entered university. The thing done there over 10 years, over 15 years. They said, no, so far you were born from 1970 to date, you have proof.
And if you see where they are talking to you, they will just be so polite and so serious.
Very serious.
They are serious.
To tell you that they don't even trust any documents coming from
you know why those documents they look,
why is it they don't trust,
you know, the paper, the type of paper that they write on, even the way people were writing, everything, you will know that it's when you see real birth certificate, you will know it looks very old, and the paper look those old papers. So I guess that's why they're not accepting this new one, because you cannot say you were born somewhere in the 70s and 80s and you're presenting a clean paper as birth certificate.
Yeah, my own no even clear. Now this particular of age, they signed it in the Ikeja Court, Lagos. High Court, Ikeja, magistrate stamp them. The government of this country refused. They say they don't trust magistrate.
Oyo, I want to know why they did not trust anything coming from Nigeria.
It's
always like, even when I wanted to do the change of names, when I present the this thing that I did, change of name in Abuja, they refused. They didn't accept it here. You can see I did what is it? Something Justice Court in Abuja. That's where I did it. You can see the stamp. You can see everything that it's original. They refused. I had to go here and do it again here before they now accepted. They put it in their newspaper here.
You're asking me a question. You already know the answer. Just like it's applicable to health system, that I might decide to treat a patient because the patient life is important. The patient wants the moment he feels better. You tell the nurse, I want water. Nurse go get water. The patient don't disappear because there is no honesty in individuals, no sincerity. Nobody is to be trusted. That's why they don't trust my declaration. I say child.
But we have solution to that problem now. We still, if they want, like you said, they can do it, because first of all, everybody needs to. You know how it is in abroad now. Everybody's in the system. If you like, do anyhow. They will type your name for computer, your house address, your picture, your everything. It's easy to find, but in Nigeria, because we don't have that, that's the problem. I remember when
and that is why they implement
when I newly gave birth, I was carrying wood, and then the wood dropped and pierced my leg, and they had to take me. My father-in-law and my sister-in-law had to take me to the hospital. When I got there, because of the rush, the stick was still on my leg. Me, I was telling my father, pull that thing. You know, in Nigeria, people always say they consign me. I said, pull that thing. And then, no, we cannot pull the stick. Get my leg like that. They carried me go to hospital. I didn't take my card, so we were like, what's the name? They had to search. They were looking until they found the name to see that, yes, I have insurance. And all of that before they now cut and open and pulled out the stick. If not, the stick, they still in my leg. Not be the same way. They just come in. The nurse will just come touch her small. If they pain you, I said, no, you know they pain me. But I know that they didn't want to remove it because they've not seen my name yet on the system. So they were checking and checking. But if I had that card, they would just flip it and put in the number and again, your name will pop up and all of that. So there's a way to find out if this person is paying tax and if you should treat the person and all. So if they want to, you have to create a system, input people's name. Because imagine those of us that are not even from these countries that we live in were in the system.
Yeah, of course.
So how much more where we come from? We don't have a system where you can find people. That's why they cannot find criminals.
Mel, you know why you're in the system. See how it works here. The moment you come in here, if you're a student, okay, and then let's say international student, you come in here and then you want to work in the school because you're meeting school standard. You want to work, you're on good standing with the school, with your GP and all of that. The moment you apply to get a job, they will issue you a social security number, but it's going to be for work only in the school. That social security number is tied to your name forever. And those that were born here, the moment you're born, they will just, everybody, nurses, the way they do it, this one will come and tell you, are you okay? Are you okay? The finance people will come. The nurse registering you for birth registration will come. And they don't even care about the name of the father at the time. It's you that ask, what's the name of your child? What's the name of your, do you want us to include the husband's name? Are you married? And at that moment, they're giving that child a social security number. It's like a tracker. I call it a tracker number.
Yes, because once you put that number, anywhere you call, the first
that is it. And then if you're a wife, they marry you, they bring you back here. The moment they file your document, they will issue you a social security number. So that's why everybody is in the system. Let me make you guys laugh. One of my sisters visited me, so they were advertising something on TV. By the time they finish the advert, they say, click to buy. So my sister said, if I click now, will they send you? I say, but try now. So I say, you won't try. She said, it's not possible. So I now clicked. My information just appeared. Which card are you paying for? My sister says, so you people are not even saying that we are in prison. That nobody is safe in our country. So if you can't even run, you can't hide. I say, but that's the truth.
Yeah.
They can track you. So for Nigeria, that when we were born, we didn't have any number attached to our names, right? They started NIM that Tonya just talked about. If they can implement that NIM, let everybody in Nigeria, they should attach a number to each person. You understand? At the same time, they will use that to track you. But trust me, some people that are very spiritual, more than Jesus himself, will tell you that is 666 coming. That the number they are giving is to put 666 number into your system. Mm-hmm. So it's a very messed up society.
But that's why they have to start it by, let's say, if they want to do it, I would suggest they start it by birth. When people go to give birth, let them register those children. So at least we know that the next generations, even if it won't happen in our own time, we know that the next generation, if they start now, they will be able to have documents and everything covering the next generations.
Just like you people said, Oyo and Mel, just like you people said that should bring up something like a healthcare program that people will be joining, so that they will be coaching them and they orienting them on how to go about some minor cases at home and to follow it up. Who will come out? Who is going to come out? Tell me, the person that we go to Eke or Oye and Pongwa, you will wait for your fathers. Nobody is coming out.
But they only come out when they have a headache. That's the only thing.
Or if you put something down there, like if you come, I give you 1 cup of rice. If you come, I give you one this thing. If you come, everybody will line up. In fact, the whole village will line up.
But when they did that program, I know they did in River State that they called TAP, where they were empowering, like let's say older women that didn't go to school. They had to teach, something to do. My mom is a caterer. She was in charge of, the catering and teaching people how to make. People came out, old, young, came out to learn how to, make things and how to make simple foods that you can make with just small money that you have available.
That one is for food.
and
Just
they
talk about that one for
and they
medicine.
teach
Nobody
people
will
how
come
to do this
outside.
crochet. And crochet, you can make so many crochet things that you can sell. They, depending on what you knew how
They
to
will
do,
come out. Some
you come
people,
and
some of
teach
them want
that.
to open up
And
a
people
beer
came
parlor.
out.
They don't know how to open it. They will come out. That one is very simple. Just talk about how to put one or two things together, nutrition and all that. They will ask you whether na akpufa na eri ozubelu. Now one for you. So
See,
when you
Sonia, in respect of what you just talked about, we have a lady here in the US. She doesn't only go to Nigeria, she goes to all African countries. If you want her now to visit your community, you pay her some certain money. She will organize doctors, free doctors. The doctors will come with her to Nigeria, doctors, nurses, and they will pack medications. They will go there for eye tests, BP, and all of that, and give them medication that will last to 3 to 6 months. Okay, if you're in a BP person, this is what you're supposed to be taking. And they
my
do
my my brother, my own brother that is in US, he's doing it right now. He's a doctor. He just graduated and he's working as a doctor in United USA. He's doing it. He comes back once in a year and brings down doctors. I know very well he paid for that. And he has to check all the elderly people. He has to check all the elderly people, give them medication, check even the people that have eye problem, ear problem. He does that.
They do that, yet this woman, she's been doing that for over 15 years. She's doing it with, she registered a charity. Even the church she attends, the church, became part of it, that they make special offering for it and then put it on their website for people to donate money for her to continue to carry that course. You understand? So people do that. And when they go, they not only don't give them medicine and all of that, they give them food. They will have a caterer cooking there until they leave. If they are going to spend a week or 2 weeks, they will be cooking every day. As they are doing treatment, at least you eat lunch, eat breakfast. So people come, but those are temporary. We are talking about permanent. We're talking about healthcare in my village.
Constance, please take that thing off your face. Make your face smiley. Like seriously. All right. In summarization, because somebody will kill you with eyes
the topic that we're discussing.
Man,
in summarization, they never thought this topic would be so
spicy.
Oh, let me tell you, they never thought that this topic was so spicy like this. That we are moving and we are moving. Some people are trying to remind me.
You know what I was thinking? Yeah? You know what I was thinking? I was thinking of how this problem can be solved, like the genesis. For instance, now,
about
the healthcare system problem. We have so many problems that we need to solve before we get to this stage. You understand? Okay, for example,
we have just one, Constance. We have just one we need to solve, then healthcare comes in.
Okay, for example, now we don't have good road. Even if you call an ambulance, where is he going to pass?
That's why I have one major problem to solve. One. Kick out all the corrupt politicians. That's all we need.
What?
Kick out all the corrupt politicians. That's all we need. If we can get people that are transparent, people that love their country. We're talking about patriotic people to be the leaders. Then they know what to do overnight. Because you know what? If it's the funds, we have it. If it's the masses to work together, we have them. So, for example, let's say we have a community that we don't have a good hospital. Like you say, we can gather people of that community. Overnight, they can clear a big land, dig foundations, start laying blocks because the funds are there, right? But these thieves will not allow those funds to be put into the right part.
We are dealing with insecurity, unemployment,
which boils down to our politicians, right?
You understand? Okay,
Mel, I understand what you're talking about, but that's a very peculiar task.
There was a time she stopped work. They called her and asked her, "Why are you not working?" How many Nigerians that are still at home without jobs? You're not working, you don't have money, and they now want you to come to the hospital and pay for your treatment. The money will fall from heaven up, yeah? So these are the problems we are facing. You said lazy Nigerian youths, be this, be that. How can they be how can it be up and doing when you have not even made
Nobody
any
can call the youth lazy now. The youths are not lazy.
They're not
They are
lazy.
extremely hardworking. They are
They're
not.
not lazy.
They are
No
not.
opportunity. No opportunity. Nothing.
Are you minding Baba? You dey mind Baba?
Imagine,
Palawo.
imagine this one that they always bring their kids to come and get treated over here, Europe, USA, and all that. And you go to the hospital, you see how they set up their hospital, everything is okay there. Imagine if you guys look at those things, get a list of it, buy them, equip Nigeria. Do you
But we
think
are trying, with
do
all
you
these
think
things,
we want to?
God is still faithful. Clinic in healthcare clinic in my own village, you will not see anything there. The forceps and all that is there that you're going to see is as old as my mom. So we are trying. This black, I think God is with us, because some women born self without all those things. They have their baby. They take the baby home. They just cut the thing and everything is the cord just that. And everything
Tonya,
is
you can say that because God, everything in Nigeria, they will call God, God, God. I just pray that people should leave God alone for 1 second and do their part. Everything they will
No,
bring religion,
Mel,
God will
just
save
listen.
everything.
Mel, you
If
just
only
need
they
to
can
do
provide
like
security,
one
investment
thing.
will come.
Only
And
one
then
thing.
for what Constance was talking about, I don't know how many of you lived in Lagos. That is, if you enter traffic, when I was working in Lagos, I was working in VI, and I live in Oba.
what
Oba
are you
area.
saying? They have stole my phone on the traffic. It's just that my kids mess. I opened the glasses and that is the end. They came to that place.
But
They came to,
it still boils down to the
Not
same
even
thing we're
phone.
saying now. First of all, Lagos should not be as populated as
that's
it
my
is.
first time of seeing gun.
Do
I
you
saw gun with my
understand?
2 eyes.
Wait, please.
It sh-
Did you guys see this video of Caroline Danjuma on
Which
Instablog Nigeria, where she was complaining that how can you buy a house of 3 billion in Banana Island and every morning you are facing traffic? Did you see the video?
No.
no.
Oh, Caroline Danjuma was complaining on her this thing that she stays in Banana Island, a house of 3 billion naira, and every morning you are facing a traffic.
Forget the girl. The
She
girl
should
knows
be
how to
ashamed of
lie.
herself. Staying in a house of 3 billion to do what?
Yeah, she knows how to lie and boo. So I don't
No,
trust
no,
anything.
no. Oyoyo, it's possible because what she was married to a Danjuma, right? And the Danjumas only God and I know how they make their money. But anyways, it is what it is. At the end of the day, because we have all these corrupt politicians that their job is to steal and then give to their friends, and then only certain people
Your
have
country,
billions and billions.
the problem
Why
with
won't
your
Lagos
country
have
that
this
is that
problem of
the richer
of
is getting
traffic?
richer while the
Because
poor is getting
imagine
poorer.
we have 36 states. Only Lagos is the one that if you hustle, you will make a lot of money. Why won't everybody go and park in that particular state? If all the states are like that, would people stay in their states and do their thing in their states? And then Lagos will not have to be that populated. That's what I'm saying. The problem boils down to one problem at the end of the day.
Mel, let me also
Speed.
chip into what you're saying before I will leave you
Yeah.
guys. I remember those days when we were in secondary school. They were campaigning for them to dredge their River Niger so that they will have another port where ship can offload, especially container coming to Onitsha main market. The Easterners tried everything they could to have the River Niger dredged so that they can utilize that port and then ease the Lagos port. But they don't want to do that because they want all the income to be in Lagos port. They don't want to do that because if they do that, they'll
Which
bring the
boils
problem
down
to
to
the east.
politics,
So
right?
everything is
Everything
like
is
you said,
politics.
it's politics and
Selfishness.
corruption. It's politics and corruption.
That's it.
If only they had opened that. I'm talking about when I was in secondary school. This thing has been going on, and look at it today. I've left university so over 10 years ago, and then it happened when I was in secondary school, right? So you cannot understand. They've been saying the same thing, dredge the River Niger, but they don't want anything that will benefit an Igbo man. You see what
Yeah,
I'm
that's
saying?
why we have likes of Tinubu now that people are saying, yes, Tinubu this, Tinubu that. Like
They
those
should
people are
not go and
extremely
take
out of
a
their
job.
mind. Like I'm not supporting anybody. I don't know, because when people are saying P2B, P2B, and I said to myself, I said, until I have a huge like a good amount of people from his state, and I can sit down and discuss with them and know what he did for them, I'm not endorsing
That
anybody, because
that's when you'll
I
be
don't know him.
convinced. Thank you.
But
Thank
people
you.
are the only thing I can say is he's young, he's vibrant, his brain is still functional. That's the thing for Peter Obi that I see, but I don't know what he did for his
Okay.
own state, so
Okay,
I
But,
don't know.
but let
ladies,
me tell you
we
one
have
or
to
But
two
then
things
round
talking
up.
Peter
We're
about
Obi
looking
did
at
someone
the
good.
like
time.
Tinubu,
Let me
because
tell
of
you one or
Ladies,
two
politics
ladies,
and
things.
ladies, let
One
us
or two
round
things
up.
Peter
Let us
did well.
round up. Thank you so much. Thank you, Mel. Thank you, Yomo. We are rounding up now because of our time, and some of us have some places to go. We never knew that this program is gonna come to this extent, but thank goodness. So, do anybody have any question down there at the floor? I have not seen any question. Mommy, did you have any question from your Facebookers?
Well, somebody has really been commenting. No question really. She was just talking about how ambulance disappointed them when her father passed away.
No, they don't talk about ambulance in Nigeria. Sorry about that. Thank you so much. And now we are moving on to conclude in assurance about what we are saying, what we thought will be of benefit, and we improve this particular thing in Nigeria. All right, Constance, go on. We can't hear you, ma'am. Hello. Thank God. Shebi understand only me. They make it. Shebi understand only me. You don't see am. I will catch you. Angel, I will catch you. The next time I will catch you.
I
You see.
said, I said I want to go to Big Brother. Big Brother is giving 100 million to the winner.
See this girl. Hey God. Ha God. Sorry for you. We are here talking about something important here. They're talking about.
How is
that's
not
why that woman
important?
said all the
When
people
there's
watching
no
Big Brother
employment in
will not go to
Nigeria, all
heaven.
the youth supposed to go to Big Brother.
That's why that
That's
mommy
the
Gio said people watching Big Brother will not go to heaven.
It's part of our problem. Everybody now wants to go to Big Brother and grab that 100 million.
So how do you want to grab it? That's the thing.
I
How
want to
do
go there now.
You want to go there?
You're asking her
Okay.
how she wants to grab it.
Angel, please.
She's set for
Can you
front,
please
set for
summarize
back.
it?
She's
Give it
supposed
a
she's
little summarization in
she
Go
how
knows
to
we
how
are
to
Big
going
do
to
Brother
it.
now,
go.
you go end up for apostle list too. No worry yourself.
All right, ladies. All right, ladies. Let's be serious here, please. We are just trying to summarize things. So, Nikki, can you please address this before we go? What do you think that is important to do to save this in our country?
Well, we are not the first people that has been saying this, and we're not going to be the last. So,
Maybe God will come from us.
I believe, Amen. So the only thing is that everything boils down to our government putting their eyes down to something that matters to us. You wouldn't say these people are not exposed enough to know what is good. Tonya, can you put your own on mute, please? This thing is kind of distracting me. Okay, thank you. So it's not like they don't know what is good or what is bad. As long as they've been coming out, it's not like people that haven't gone out of the country before to say, okay, we have seen something, this is actually new or this is good and things like that. They have been going out of the country, getting themselves treated, getting their family members treated. They've gone to the hospital, seen the environment and everything. So it wouldn't be a bad thing to just, because one thing that we need in our country, we already have educated people there. We already have people that they've gotten this education. They just have to implement it, how to make use of it. But you see them running away from the country because at the end of the day, why would you go to school, spend 6 years of your life doing medicine and all that with your intelligence and everything, and then you end up not getting a job or not, or maybe getting the job and not being paid? So those are the things they have to look into. If they can get those equipment for them, place them in a very high. Come on now, come on now, doctors. They are well paid. Doctors are well paid. Over here, if you're a doctor, now money you the bag. You understand? Because it's not an easy job. Those people they spend sleepless night trying to save people's lives. So it's not an easy job. So down there, looking at those people is more like they don't even regard them as anything. And that is why you see them, they all want to run out to go to where they will see them as somebody. They will see that degree, they will see whatever they have in their hands, all their talent and everything as something. So that is why they are all running away. So for all those things to stop, because it's not everybody that have money to afford overseas treatment. Not be everybody. We have a country, we have where we come from. If you're like now as I am now, even in as much as I'm in the UK, God forbid my mother falls sick and they say, this sickness cannot be treated in Nigeria. It is I get money to fly her over to come and start taking trees. No, I don't have the money. So if we have that kind of, if we have everything in Nigeria ready for us now, the only thing you can say, okay, maybe it's expensive, but there will always be a way to provide for the poor. The poor also deserve to live. They deserve good treatment as well. No be person say maybe they poor. It's not their fault that they are poor. In as much as some people they don't want to struggle and all that, but at the end of the day, life is not something we have to say, okay, because they work hard, that's why they sick. Nobody can dictate what will happen the next minute. So they have to put all those things in place for us. Now they beg them. The money is there. It's not like the money is not there. The money is there. These people can do this thing. But just for them to forget about thinking just about themselves, being selfish and self-centered, and also think about other people that are hopeless or helpless. So that's all I can say for now. Thank you,
Thank you so much, Nikki. We love you. Constance, can you ship in something?
I think Nikki kind of has said it all, because at the end of the day, we have a problem that needs solution. You understand? And finding solution starts from the top, from the government. You understand? Eradicating them corruption and putting the necessary things in place. And when it comes to healthcare system, like, I think it should start from the government having value for human life. You understand? Because, and I think it should also start from loving the citizens, because it's only when you love the citizens you will have their interest at heart. You understand? They should stop being selfish about this whole thing, because they are being selfish. Because if it's not selfishness, when you are sick because you have the money, you fly abroad, or fly your family members abroad. What about the citizens itself? So it has to start from them loving the citizens, having this sympathy and empathy for the citizens. You understand? Having our interest at heart, like looking for solutions, because we have the money, we have the resources, we have what it takes. Nigeria is big. You know, when I was thinking about Nigeria and Senegal, like, I can't compare these two countries. Senegal is just too small when it comes to comparing it to Nigeria. So Nigeria has all it takes when it comes to education, when it comes to talent, we have it all. And our youths are doing very well. When you go to educations abroad, like our youths, if they are there, they always come out like they are among the top when it comes to abroad, when you go to where they are studying. So we have what it takes to make our country work. So we have to start from the Genesis. Have that love for the citizen itself, have their interest at heart, stop being selfish, look for ways to make it work. You guys are thinking about sending coppers to rural areas. Yes, if some of them are not agreeing to go, make it the place more conducive for them. The infrastructure should be okay, the house you are giving to them should be okay, the salary should be fat, something that will make them want to do so. You understand? So that at the end of the day, wherever they are deployed to, they will have that interest, and okay, this is where I'm posted, let me work and give my all. You understand? So they have to provide all these things and make it necessary for the citizens, for us to have that small sweet life is sweet. Yeah, it's really not fair. It's really not fair when it comes to citizens. But at the end of the day, what can we do? Like Mel said, we have to start from the top, eradicating all those corrupt things. Because at the end of the day, if they are not eradicated, as the youths are coming, they are corrupting them. Understand? I was just watching one Korean movie about corruption. They were top officials in the company. They now invited one guy that he should come, that they are going to coach him, they're going to tell him. But the guy, having that sense, he was like, oh, sorry, I'm sorry for coming here, I don't belong here. Don't just assume that he agreed on what they are saying, and he wanted them to corrupt him. That's how the corruption will continue. You understand? So if our leaders, and if the should I say presented candidate, which is to be, will win, if at all he's going to win, or anybody, let them take Nigeria to where it's supposed to be, because Nigeria has all it takes to be a better country. That's all I'm saying. No, that's all I want to say, because it's really, really, really very sad. But who am I to talk? What can I say?
Yeah,
All right. Thank you so much, Constance. Oh, are you still there?
Yes,
Yes.
yes.
All right, darling.
All
You
right.
just
Thank you,
with a
everyone. I'm
little
gonna make it brief.
summarization, just give us hit it. Let's
Yeah,
just move.
I'm gonna make it brief. Nigeria has the resources to be a better country, a health system as well. There is this wise saying that health is wealth. It's until we start looking at it from that dimension, that's when Nigeria will wake up to reality. But unfortunately, they are not seeing it that. We are calling for, I think somebody talked about getting rid of the bad corruption or be, how did he say? Mel, you said getting rid of the corrupt officials.
Officials.
The thing is that it's not only the officials that are corrupt. Every Nigerian is part of it in one way or the other. And the reason why I said that, if you have an item in cost,
Oh yeah, you're not every Nigerian, no.
no. I will say
Not every
90%,
Nigerian, because I can tell you, I can put my
90,
hand up and I can tell you
let me
that my
say,
father retired as a post primary schools board zonal director, and every time school he's responsible for paying people's school fees, sorry, people's salaries, and he used to return bags of money, and he was called a fool. And my uncle also, that was the PAM secretary of Rivers, old River State, did the same when he was paid his gratuity. If you search for it, I can give you his name. They will tell you he returned the money. He was like, why are they giving, when he was retiring, that big money they pay government officials? He returned it. They were like, why would he
yeah,
be paid
Mel,
that? So we have
you're talking about
sincere people.
those. You're talking about those people. Let me say, okay, not every Nigeria, but I can say about 90 or 95% of Nigeria, in one way or the other, are involved in corruption. And how do I say that? If a police officer should stop you on the road and ask for 20 naira, you giving that 20 naira is also part of corruption. That's why I'm saying that everyone is involved. If you stand your ground as officer, your DPO said that if anybody is collecting $20, we should snap the picture of the person. That police officer will know that you're right. But it doesn't
But you know
happen.
you're going to get shot. And when you snap the picture, you will
I
not
know,
end up getting anywhere
that's
with
what
the
I'm
picture.
saying.
So it's the fear of what will happen to you.
The fear of what will happen is what is making everybody, kind of involved in what is killing the country. The health is wealth. We should look at it from the point of view. We should sanitize our people to know that if they hear ambulance siren, they should try and pathway
Clear road.
anywhere
Clear road.
clear, because the roads are so tight. So sometimes there is nowhere to clear.
Is
They
that
should.
time you will hear them to insult each other?
They
They
would.
thunder fire you there. May your papa die.
They will be able to talk to the Agboro people, to teach the boss people in their local dialect, the essence of the ambulance siren and whatever. That's one way to help. And also, we are asking the government, the people sending youth corpers, they should also send them to rural areas, to the health centers. They will be able to help save lives.
And promise them something.
Everything is not just the government. Also, the private sector should play their part. Every Nigerian should play their part. If we want to rescue the soul of this nation, which is the cry for the P2B administration, rescuing the soul of Nigeria will start from those people that are age 4 right now in kindergarten, preschool. Try to teach them patriotism so that they will have the love for country. The love for country will lead to a better Nigeria. Thank you.
Thank you.
Thank you so much, Oyom. And Mel?
You've all spoken well. You've actually hit the nail on the head. I don't really have much to say. But all I have to say is the youth should realize that the moment they start speaking, standing up, taking decisions, other than sitting down and saying, what can we do now? What can we do? What can we do? Your future is in your hands. Most of these leaders that we have right now, they're already old. Yes, they're going to hand over to their kids and all of that, but make sure that you speak up wherever you are. And if you're being sent to rural area, don't say, because I want to work in the best hospital in the city, I want to stay there. That means you too, you're part of the problem, just as the other ladies they've stated. We can do something about it. Let's start from there. Let's start by knowing that we can do something about it. And like I said, love your country. Constance said, love your country and love yourself. And you said, be patriotic. These are the two things we need. If you love your country and you're patriotic, you will always want the best for your country and its citizens. So let's start by kicking out these politicians that they've been here for many years and they've not done anything.
If they
And let's
bribe
start
you,
with fresh
correct.
people that we can give opportunity to
If
see how they
if
are
they will
going to
allow you
act.
to kick them out because they are stagnant. If they
See,
will
if
allow.
they bribe you, collect the
Well,
bribe.
well,
On
well,
election day, do the right thing.
it will always be a fight, okay? Those people that are called heroes, they are not called heroes for no reason, okay? You cannot just hide in your room and be a hero. You have to stand for something. We have people that are standing for something. We have people that are outspoken. Even now, with the way the country is, they are speaking. Some people are in jail now because they spoke against certain people. So you have to stand for something if you want to be hailed as a hero. And collectively, we can all do it. It's not the problem of the East, the West, the South. No, we are at the end of the day. If they drop one bomb, both and all of us will melt there, okay? It's not going to affect just one part and another part. So let's start from knowing that we can make a change. And that's it. That's where I'm just going to end it.
Okay, my darling Mel. Thank you so much. You've really tried. Thank you all, ladies. With a little thing I've heard from what you people have said in summarization, I know very well that Oyoyo did mention something like we, the private sectors, should come into this also for it to work out. It's not when the government is trying to bring, let's assume the government accepted now to furnish all the clinics. We are the private sectors to help make this thing work. We will be busy embezzling it on our own also, taking it to the market, selling them, and waiting for another one to be bring to the table. We should also help. Let all hands be on deck. That is exactly what they mean. And thank you all. We love you guys. Peace. Thank you
Bye.
so much, ladies.
Bye.
Bye.
Peace out.
Hmm. All right, all right. Thank you so much, ladies. I love you girls. I love whatsoever you did today. Your shipping and everything you said is nice. It is well. We are going to get a better Nigeria so soon. Thank you all. I love you all. It's still your guy, UD. Ashton's family, UC&UD. Thank you all. We love you guys. Peace.